Good afternoon, folks. It's a pleasure to be here. Thank you to Bob and Marianne for inviting me along, and thanks to all you folks for staying around and staying warm, and I'm glad to be here. So, as Bob said, I'm going to focus on introducing the potential to use clinical data. So you folks are being treated with tumours, are supporting patients who have been living with this disease, and you're gathering clinical data. There's data that you're generating just by going through your diagnosis and surviving for as long as you do. And that's great, and it's good, useful for people like me coming along to access that data and use it for research purposes to benefit patients again in the future. So it might be of benefit to you, but it might be a benefit to people that's coming along after you. And so some of the slides that I'm going to present today are in relation to the use of clinical data for that purpose. So this time last year, in April 2023, the National Cancer Institute offered a roadmap for cancer research to achieve Cancer Moonshot goals. If you haven't heard of the Cancer Moonshot goals, it's set up by the Biden administration. They basically have 8 goals that are tied to different objectives that we're going to meant to be reaching by 2024 or 2047. So the next 25 years or so of cancer research. And one of those goals is to make sure that effective treatment with minimal side effects is available for all patients, not just patients with common cancers, but also patients with rare diseases as well, and that includes neuroendocrine tumours. One of the other goals is to reach a reduction in 50% of cancer mortality, and that's all cancer mortality, by the end of 2047. So there are big things to move, big markers to move, and we're not going to move the needle if we don't actually focus on rare tumours as well. And the best way to do that is to make progress for these rare tumours is also to think about ways that we can gather data on tumours like this. So using large-scale clinical research networks and employing those for cancer research, and that's what I'm going to talk about the rest of this afternoon. So have your phones ready. I'm going to have a few QR codes that you can scan and access some of these papers. This is a paper that our whole NetPro study team, and I'm going to talk more about NetPro and what that is in the next few slides. And we published this commentary in Cancer recently, looking at making progress against rare cancers, and we used our neuroendocrine tumour study as an example of how to do that. So there's more detail in that QR code if you want to scan that. And I've got another one coming up at the end about how you can actually participate in NetPro if you're not already. So a little more about using large databases for research in cancer. Folks in the room may or may not be familiar with PCORI. PCORI are the Patient-Centered Outcomes Research Institute. They've been working for many years with these Cancer Moonshot goals, so they're not unfamiliar with these Cancer Moonshot targets. They developed PCORNet, which I'm going to talk a little more about in the next slide. It's the National Patient-Centered Clinical Research Network, and it's been developed to conduct large-scale patient-centered outcomes research faster and more efficiently through reusable research infrastructure, and I'm going to talk a little more about that infrastructure. So we got this NetPro project funded during the pandemic, and some of the folks in the room are probably involved in that study. Show of hands, anyone who's familiar with the neuroendocrine tumour patient-reported outcomes. I know, Ellen, you're a potential patient in that, so there might be a few of you who've heard of this research, and I'm going to talk more about it and hopefully deliver some results from that as well. So PCORNet, as I said, it's a network of networks. So basically, in the United States, we gather electronic medical record data. So your medical notes from seeing all of the physicians that have been up here this morning, Dr. Chandra Shekaran, Dr. Do Dillon, meeting with Dr. Jim Howe, for surgical approaches at Iowa. We've got access to your medical records at Iowa, and we can, not just at Iowa, there's 60 other clinical centers across the states that are involved in PCORNet, and that data is gathered and we can use it for purposes of research, and that is kind of what we try to do. So this data is linked to your medical records data, and what happens is that at specific intervals, usually we call it every quarter, each of those 60 medical centers in the US deposits data, standardized data, and you can see in this, we call it the common data model. And this has information on things like your demographic information. It's all anonymized, so we can't identify individual patients at Iowa from other clinical centers. But we get information, for example, on diagnostic codes, so ICD codes for particular diagnoses that you might have, pre-existing comorbidities, information on drugs that you're currently receiving, including cancer therapies. So we can identify treatments like PRT, treatments like that. We can look at conditions that you might have. We can look at death records, so identify the patients deceased or still alive, and then causes of death as well. So we can gather a large amount of data from the medical notes on patients. The best thing about PCORnet is that it allows us to contact patients individually, to consent and take part in IRB-approved research. And we're going to use the example of the NetPro project moving forward to discuss a bit more about that. So NetPro stands for Neuroendocrine Tumors Patient-Reported Outcomes. It was funded by PCORI in 2022, and I'm going to talk about that in the next few slides. So why have we done NetPro? We've heard a lot throughout this morning and this afternoon about how NETs are relatively uncommon, but their incidence and prevalence is increasing. We've seen lots of slides that have documented that increase. And as we've talked about, they tend to be slow burn tumour, unlike other solid tumours. And these patients, as you know, have prolonged survival, protracted survival, and may receive multiple lines of therapy over the course of their treatment. A health-related quality of life is an outcome that is not very well researched, and not a lot has been done on that. And so I'm going to present some results at the end of the slide deck in relation to what we're seeing and observing with health-related quality of life from our NetPro project. As we've kind of identified, working out an optimum treatment sequence, so treatment sequencing is a big thing that we're trying to get at NetPro, and then try and provide some data on grade 3 NETs and lung NETs in particular that tend to have limited data because we're working with single centres, single clinics, and because there's a relatively rare tumour, we need to be looking at accumulating data from multiple sites to move the dial on treatments and what works best for different types of patients and patient groups. So we've been working with a lot of patient advocacy organisations, NCAN being one of them, since 2021. The questions that we're trying to address in NetPro were basically patient-driven. So patients told us, Michael, I'm wondering what therapy would be best for me to try next, or if I was to take this option now, what therapies would be cut off to me in the future? And we've talked a lot today, we've seen even from Dr. White about, liver-directed therapies and the potential there to maybe damage normal, healthy liver tissue. And so for those folks, if I go down that route, what other options would be available to me after, what's going to work best for me? So hopefully NetPro will get to addressing some of those parts. So NetPro is probably the largest prospective investigation in NETs in the US to date. So I'll give you some updates on where we're at in terms of our enrolment and recruitment, which is still ongoing. Before I do that, these are some of the aims that we're hoping to achieve in the NetPro project. So we have 4 main aims. One's describing how common treatments are received by patients, looking at individual sequencing of treatments, what's every patient enrolled in our study, how are they actually being treated. We're looking at their clinical factors, tumour factors, so we're gathering all this information from their medical record notes and also doing patient follow-up surveys over multiple time points with patients. And then aim 3 is a comparative effectiveness aim. We're looking at PRT, as we've just heard from Dr. Bushnell, how important that therapy is for patients with NETs. And we're looking at the various treatment combinations they've received prior to PRT and during PRT therapy to see how that relates to outcomes of toxicity and survival. So 14 sites involved in NetPro. You can kind of see in the map here just how dispersed we are across the states. So we've tried to get good geographic representation from rural and urban centres as well in the mix. Iowa is the lead site here, and you can see that we've got lots of other large sites. We've got Mayo Clinic, we've got Ohio State University, we've got Michigan, Pittsburgh, and then a lot of Vanderbilt and lots of others around the country involved in this study, so 14 sites. So how are we doing on enrolment for NetPro? It began in May 2022. It's going to continue through until October of this year. We are looking for patients over the age of 18 with a new diagnosis of a NET, that has to be a gastrointestinal or pancreatic tumour or a lung NET tumour. And they have to be diagnosed from 2018 onwards, and basically we're identifying these patients via their electronic medical records. We've developed a computable phenotype, which is essentially an algorithm that looks at diagnostic codes in the medical record to help identify these patients. We're looking to enroll 2,500 patients in total by the end of October of this year using low-touch methods. So the majority of patients that we identify through the medical notes are being then contacted via their clinician or via an email to take part in the research. So where are we in terms of our enrolment to NetPro? So right now, you can see early April, we were sitting around 1,879 patients enrolled. As of yesterday, we actually have 1,920 out of our 2,500 enrolled. So we're over 75% of the way there. So we're getting there. I think we're enrolling roughly 100 patients a month across the states into this project. So it's a huge, as you can imagine, it takes a village to do this type of research in a rare condition. So I think we're managing very well and getting good enrollment and recruitment and engagement from our 14 sites. We've got 580 patients then left to enroll. So still a little way to go. This is what it looks like across the sites. So the orange bars represent the patients actually enrolled versus the patients that have completed their survey one, their baseline survey. And you can see there's pretty decent decent tally between those who enroll and also start completing their surveys. And we've seen pretty much patients are willing to take part. Thanks to all you folks for enrolling in the project. We have about 80 or 82% follow-up on folks that actually have consented to the study, which is great. And that's across all time points. So we've got 4 time points in the study, as you'll see. So as I said, we're really, the basis of the project enrollment is online. So patients are consenting online or being consented by their clinician in clinic. And they're enrolling into the study, and we have our patient partners helping us disseminate research findings and also get involvement from patients as well. A bit more of that to come at the end. So in terms of our electronic consent and enrollment, we developed a patient health record portal. So patients are directed to this portal, a bit like an app on a website that gets you to electronically consent to the study, also gets you to confirm your details, confirm your eligibility for the study, and create a study account, and then also complete your first survey and then subsequent surveys every 6 months for 18 months of follow-up. So we got 4 surveys in total. We got patients from our patient advocacy organizations like NCAN to send out to folks like you to get involved in focus groups, and from those focus groups, just as a way to, I suppose, support ongoing engagement with patients while they're waiting every 6 months to take a survey for us, we've decided to try and give something back to patients. And one of the things in the focus groups that came through is patients wanted to be able to track their data that was personal to them. So they wanted to look at symptoms that they have, especially the GI small bowel tumours, for example, that have a lot of symptoms with their tumour, and a lot of things like diarrhea and flushing and lightheadedness, all sorts of things, all sorts of signs and symptoms. They want to be able to track that and map it towards medications they're taking, or and be able to look at a 30-day period, what's affecting what elements of my dad are triggering symptoms for my disease, things like that. So this allows them to do that in the interim. So in terms of our surveys and how we're collecting information for NetPro, we've got 3 types of data we're being collected. We're doing our 4 patient surveys every 6 months, so baseline, 6, 12, and 18 months. And then we're also pulling data from the electronic medical record for these patients with their consent. And then also we're doing targeted chart reviews. And you can see some of the items we're gathering from this. It's a rich data set, so we're getting everything from quality of life, which I'll show you some results for. We're getting symptom information, we're getting preferences and attitudes, like what they think and feel about their treatment, how they've been consulted, that shared decision-making process. We're asking questions about self-reported treatments, so what patients can recall, treatments that they've received, so we can compare that to what's being found in the EMR. Lots of useful information over time. In terms of the EHR, we're pulling things like lab values, toxicity, so renal failure, dialysis, liver failure. We're pulling all those diagnostic codes. We can split this then, you can imagine, by lots of demographic factors. We can split it by race, ethnicity, see if there's any disparities or inequities in access to care amongst NET patients across the states. We're looking for tumour characteristics. We're looking at status of disease over time, so progression-free survival, all those tumour markers we've heard talk about today, chromogranin A, Ki-67, proliferation index, mitotic index. We're trying to pull all of that data for all of these patients as well, so we can monitor follow-up and outcomes of all the various treatments these patients might be receiving. So some preliminary data before I wrap up for folks, just to give a bit of an insight as to what we're going to be doing with all of this data. So this is preliminary. I will say there's a few caveats to it. Right now, as of early April, when I did this data pool before the conference, we had 1,743 consented patients. So you can see we've increased by about 280 odd patients since then. Our health-related quality of life is being assessed by principally the QLQ-C30, which is a generic cancer quality of life questionnaire, 30 items. And we also combined that with the GI-NET specific items and also some LUM-NET specific items, so capturing things like breathlessness and cough and things like that. And what we're going to do then in the next few slides is talk about a group of 137 patients who've completed all 4 time points so far in NetPro. So bear in mind this is only 5% of the total final cohort, so it's pretty preliminary data. I will say that some of the quality of life, it's not anchored to their time point of diagnosis, and that will be important to consider when we present the slides, and I'll remind you of that. And let's have a look at some of the data. So first thing I did when I thought about this and I was pitching it to the audience that might be in front of me, wouldn't it be really useful to look at some of the statistics basically on these patients? So instead of pulling demographic factors, which I will do eventually, I kind of thought, well, what about pre-existing conditions? Because there's a lot of clinicians in the room, they see these patients day to day, and they are actually very heavily comorbid. Mary presented slides this morning about patients with multiple conditions. It's not just that they're a patient with NETs, they're a patient with other comorbidities that might impact treatments that are available. So you can see that actually only 10% or less than 10% of our enrolled cohort, so of those 1,700 patients that have enrolled in NetPro, there's about 10% that have reported no comorbidities. So you think of the average age of a NET patient around 60 years of age, right? So it's not uncommon that they'll have other comorbid conditions at that point in their life. But we see about 75% of patients enrolled in our cohort have more than one comorbidity. So there's the majority of patients, as you can see from this graph, have about 2 or 3 comorbidities at any one time. And what are they? So the next slide kind of shows a count of 14 comorbidities that you've probably heard of the Charlson Comorbidity Index. These are some of the variables that you would record on that index. We use as a clinical marker for comorbidity. And I've highlighted in grey the one about prior history of cancer. So about 16.5% of patients enrolled in NetPro had a prior history of cancer before they got their NET diagnosis. And that's not uncommon, right? So for this age group, about 20% of the population would be expected to have a history of any other cancer. You can see that hypertension was high up there, so these are rated in terms of the most common comorbidities. So hypertension was common, cholesterol was high cholesterol was 44% of patients had high cholesterol. Depression, 38% of patients had depression or anxiety. Again, 35, almost 36% of patients had arthritis or some type of arthritic condition. Again, with colon problems, irritable bowel, Crohn's disease, ulcerative colitis, diverticulosis. Again, like 24, almost half of patients, quarter of patients had those existing conditions with the colon. And I haven't split this by GI site, like a small bowel NET versus LUM-NET, for example. Some of my slides will be. So that was comorbidities. What about health behaviours? So we asked obviously about what patients are doing in terms of their day-to-day, how do they live their lives? And we've got listed 11 health behaviours here. The blue bars represent patients that were answered the question, this is very much like me. The red represents those patients that this wasn't like me, and the bits in the middle, the yellow, represent those patients that say this is something like me. So you can see that the majority of patients are aware of their general health. They take medications as prescribed. Most of them don't smoke. Most of them see a doctor regularly. They're good. They take vaccine uptakes well. More than 50% had a use of a regular multivitamin or supplement. Around about half were moderate drinkers. Relatively fewer, so towards the bottom of this chart you can see the more yellow appearing, and that's people who were something like me, basically where they were maybe less likely to eat a healthy diet or maintain a healthy weight or exercise regularly. And that wouldn't be uncommon in this older age group, right? So that's slightly coming into late 50s, early 60s, where most of these patients are being diagnosed. So it kind of makes sense in a way. So what about health-related quality of life changes over time? So this questionnaire, the quality of life questionnaire, general quality of life in cancer patients, 30 items, the numbers in brackets after each of these functional scales represents the number of questions relating to that scale. So we're looking at things like what's your cognitive functioning like after this tumour? What's your emotional functioning like? What's your physical function like? How able are you to get on with your daily activities of daily living? So going for a walk, things like that. role functioning in your community, and then also social functioning. So has your social life been affected by your cancer treatment or diagnosis? And you can see that for the mean scores here is what we're looking at. So you want to look at that column that says mean. And anything with a negative value means that over time, between survey 1 and survey 4, so this is within our 140 patients who've completed all 4 time points so far, so 5% of the cohort, we're seeing reductions in things like cognitive function, we're seeing slight reductions in things like role functioning. And I've kind of split this then, as I'll show in a later slide, by GI site, so like GI specific and pancreatic cancers versus lung tumours. So again, functional scales here, trying to just display this in a GT plot to make it a bit simpler to see changes over time. So basically, the line in the middle, the 0, means that there was no change. So the majority of patients, the higher bar, represents that most patients actually stay pretty stable in terms of a lot of these indicators and scales. That's a good thing, right? So you want to know that treatment then is working well. What we want to do later on is kind of segregate this down, what we call stratified analysis, break it down by tumour site, break it down by treatments received, and break it down by age and other factors that might be informative for patients and for clinicians. But there is, as you can imagine, there's a huge spread in changes of quality of life. So the scale runs from 0 to 100 or 0 to minus 100. Those in the negative scale means that their performance in all of those functioning scales is worse. Those in the positive end means that the functioning was better. So you can see things like physical functioning, emotional functioning, physical functioning in particular there, and the emotional functioning, so those in the green and the brighter green. Those two scales, there's a huge dispersion amongst patients, and it's hard to see on that scale at the side because I've kind of bumped them all together. But in those individual patients, there seems to be huge variation there, and some patients are doing really well and some patients aren't doing so well. And so we'll want to break this down to look at this in a bit more detail. This is it just split by GEP nets, so pancreatic, gastrointestinal nets and lung nets. Again, look at the mean scores. And within the GEP net patients, you can see across all those functional scales that there's still reductions over time in functioning and cognitive functioning and physical functioning and role functioning. So their role in the community and how that's been affected by their cancer diagnosis. That involves work and ability to give back to their community. Lung nets, again, things like cognitive functioning, really poor. I mean, that's a change of 4. So it seems like lung nets, for example, have worse cognitive functioning outcome than GEP nets, just as an example. Plus, we also see scales here that are increasing, right? So the mean is actually increasing over time. So that means there's improvement in emotional functioning, and there's improvement in social functioning across both of these sites. So some good outcomes occurring as well. So a positive story overall too. And this was just looking at symptoms. Again, showing these plots that, the majority of patients have no real change in symptoms. So that means that when we start segregating this by the treatments they're receiving, we'll be able to tell which treatments seem to be benefiting health-related quality of life more than others. So there's going to be some interesting results, I think, ultimately coming from the study on this. To skip through some of these, I was just looking at others here. So symptom scales, these are single item, looking at things like appetite loss, constipation, diarrhea, difficulty breathing, shortness of breath, or financial problems, and then poor sleep, insomnia. Again, we see some of those decrease, that mean score being reduced. So we're seeing, reported appetite loss. We're seeing things like constipation increase over time. We're seeing things like diarrhea reducing. We're seeing things like financial problems reducing over time, and things like insomnia actually slightly increasing there. And that's it, just showing it graphically for a bit more detail. And then what I'm hoping to do is break down these single items. So what I've shown you before are just basically big, large buckets and groups. But we ask patients a lot of questions, and this graph kind of shows survey 1, survey 2, survey 3, survey 4. So every 6 months that survey, and then changes in quality of life over time. So this question was, did you worry in the past week? And then so their patient has answered this every 6 months at 4 time points. And then we're able to track then, okay, for that individual patient, how did they respond? And you can see with the 140 patients that have answered this question for 4 time points, we're seeing overall trend of worrying increasing, and there's more people in the quite a bit, a little bit, and very much categories over time. as their diagnosis moves forward. The same with the need to rest or nap, so again, fatigue. We're seeing fatigue is an issue for patients. Again, if I started separating this out by cancer site and treatments that they're receiving, it's going to be more informative, right? So for clinicians and for patients, you're going to know which treatments are having a worse effect or impact on patients. So that's hopefully a bit of an insight as to what the clinical research and data that we can pull and the patient-reported outcomes that we're gathering can do for patients and do for treatments that patients receive. Another QR code for you to scan here if you're interested. So for those folks who would like to get involved in NetPro but aren't getting treatment at one of our 14 clinical sites, you can access this QR code. It's just a place for you to enter your name and your email, and we'll get back to you when we're ready to start this NetPro Global. So we're working with our patient partners like NCAN, like INCA, and we're looking to extend this study not just in the States and not just in other clinical centres in America, but also worldwide. So we have patient partners in Australia, in Europe, elsewhere. We're going to be getting those folks involved as well, and hopefully broaden out recruitment and get good general results for patients with NETs across the world. I think that's where I'm going to stop. Thanks very much, and happy to take any questions too.